Hi, I'm Jessica Thomas, Director of Patient Education for the Net Research Foundation. It is time for our Thrivership series, and today we're going to talk about three things and how they're interconnected. We're going to talk a little bit about sleep. We're going to talk about sleep hygiene, and we're going to talk about fatigue in your cancer journey. And we're going to talk a little bit about how these three things are interconnected and ultimately can help support emotional wellness and quality of life. So stay posted and we're going to dive right into the details. Fatigue can have impacts on us on a physical level, on an emotional level, and on a cognitive level. Fatigue can feel like an overwhelming sense of tiredness. You can feel like you have low energy, that you're weak. You might not have the same stamina that you had before, and might have a general sense of sleepiness. It may also appear really alongside sleep problems and other mood issues like anxiety or depression. In some cases, fatigue can be contributed because of symptoms that you may experience. For example, if you experience a flushing or diarrhea, then that can increase the level of fatigue that you're experiencing. And also, if you're not able to get adequate nutrition, sometimes that can contribute to fatigue as well. So fatigue is a very difficult symptom for many because it's invisible. A lot of times we feel it inside and other people cannot see it from the outside. So we're going to talk a little bit about some strategies, some tips that we can do related to sleep hygiene that may help improve some levels of your fatigue. Now, fatigue may always be a part of your NET cancer journey, but there can be a couple of things that you might be able to do to improve sleep hygiene, which ultimately will help with some levels of your fatigue. It is important to note that if you experience fatigue to a level that it is hard to control through things like good sleep hygiene, then I greatly encourage you to talk with your NET specialist, to talk with your oncologist, and even your primary care doctor. There are some things that can be helpful for fatigue if you are trying other strategies and they are not working. So it is always important to let your healthcare provider know, because fatigue absolutely will impact your quality of life and your emotional wellness. A lack of sleep can have several negative impacts on people living with cancer. For starters, it weakens our immune system. Sleep really plays a critical role in the functioning of our immune system. And so a lack of sleep can make it harder for our bodies to fight off infections and recover from illnesses and to be more physically resilient. Also, a lack of sleep increases our fatigue level. It's not uncommon when you're living with NET cancer that just the idea of living with NET cancer, as well as maybe going through treatments, can already cause fatigue, and a lack of sleep can exacerbate the symptom. This can lead to a vicious cycle where fatigue makes it harder to sleep, and then poor sleep quality increases fatigue. It also can impair our cognitive function. Sleep is essential for cognitive function, including our memory, concentration, and decision making. A lack of sleep can lead to cognitive impairment, which can impact your ability to cope with your illness and treatment, and also can greatly affect our emotional well-being. Often when we are not well rested, we can be more irritable, more anxious, or even more sad. Managing emotions is important for anyone in a Thrivership journey, and the lack of sleep can make it harder to cope with the emotional aspects of cancer. So now we're going to talk about tools. What are some things that you can do if you're struggling with getting enough sleep or getting good sleep? So we can improve our sleep through adopting good sleep practices, and these are often called sleep hygiene. So a couple of tips for this. One is to avoid screens. This would be like your telephone, using your computer, watching TV in bed. So you allow your bedroom to be essentially a bedroom, and that's where you sleep. You also create a good sleeping environment, making sure your room is cool, that your the ambiance of your room is going to help you to sleep as well as you can. It may be beneficial to have a white noise machine, to have fans, to have whatever helps you to promote yourself to have good sleep. Having a consistent sleep schedule, so going to bed and waking up at the same time every day, even on the weekends, and this kind of helps your internal body, your internal body clock, to get used to your sleep patterns. Also, limiting stimulants, so trying to avoid caffeine close to bedtime. It's same with alcohol because they can interfere with your ability to sleep well. Exercising regularly is a part of sleep hygiene. When you engage in physical activity, and not close to bedtime, but earlier on, that can help you rest easier. Maintaining a healthy diet and avoiding meals close to bedtime. Managing stress. So often when we lay down to fall asleep, if our minds will wake up and we'll start to think about the things that have been bothering us for the day. So it is good to practice stress reducing techniques such as mindfulness, meditation, or yoga before bed. I also think it's good to journal a little bit. Maybe not while you're sitting in the bed, but to help get out the emotions of the day. Finding some way, some routine, and some strategy to let go of the day before you lay down. And if you need to take naps, to limit those naps. I always think that one of the best things we can do is set a timer. So if you're someone like me that needs to take naps every once in a while, make sure that you set a timer on your phone. That way that you have plans to wake up and that you don't get in too deep of a sleep where getting out of the nap is hard. But if you're having persistent problems with sleep, I encourage you to talk with your doctor. There are many tools and strategies that you can do for yourself, but if you're trying these things and they are not improving your sleep, it is important to see a doctor and to consult with your healthcare provider. So I shared a good amount of resources today. We talked a little bit about fatigue and how that may be something that you experience in your cancer journey, as well as sleep and its role in how it can impact our fatigue levels and overall our emotional wellness. But we talked about something too that I think is important. We talked about sleep hygiene. And when I think of Thrivership, I think of the things that we can do that are in our control. And sleep hygiene is one of those things. So if you're dealing with a great level of fatigue and you are trying hard with sleep hygiene tactics and tools, and it is not improving your quality of sleep, I encourage you to talk with your doctor and your healthcare team. And I am here if you have any questions on this topic. Again, I am Jessica Thomas. I'm the Director of Patient Education for the NET Research Foundation. My email is here on the screen. Feel free to email me if you have any comments, questions, or concerns. And I look forward to seeing you next month.